A pleasant day to you all. Welcome to the show. My name is Bernard Mpofu. Zimbabwe is experiencing its third wave of COVID-19 infections. And in the midst of this pandemic, many are asking, how long is it going to continue, as well as what's next? And today in our virtual studio, we've got the World Health Organization country representative for Zimbabwe, Dr. Alex Gasasira. Welcome to the program, sir.
Thank you very much, Mr. Mpofu.
All right. So maybe as an icebreaker, just take us through on maybe the major development that have happened since COVID-19 was first reported here in Zimbabwe.
Okay, thank you very much. We recall that COVID-19 was reported, the very first case was reported in Zimbabwe in late March 2020. But even prior to the first case being reported in Zimbabwe, because the World Health Organization had declared COVID-19 public health emergency of international concern at the end of January 2020, and had declared this a pandemic in early March 2020. So even before the first case was reported in Zimbabwe, Zimbabwe had already started putting in place the necessary preparation to respond to the pandemic. So by the time the first case was reported in Zimbabwe, if my memory is correct, it was on the 20th of March 2020, a lot of work had been done to prepare the country to deal with this condition. After that, the cases continued to be reported, numbers continued to go up. We had our first peak in about around July, August 2020. That's the time we had the highest number at that time, and where we saw cases going up and then coming down again in response to the response efforts that the country put in place. And then we saw again another rise towards the end of the year, beginning around October, slow increase, November, then December we saw rapid increase, January, very rapid increase. We had very high numbers, January, February, and then again we saw the numbers start to come down again. That sort of represented what we would call the second peak or the second wave. The numbers kept low, again, because of all the actions that everybody was doing. And then we saw a slight increase in April this year, but not again, slight increase that again was controlled very rapidly. But unfortunately, we started seeing numbers going up very, very rapidly last month in June 2021. And we have seen the numbers continue to escalate up to now. And this is what everybody is referring to as the third wave. This is the third peak that we are seeing of reported COVID-19 cases in Zimbabwe.
Thank you very much, Doc. We've heard about the socio-economic impact of the pandemic. From where you stand, what do you say are the major, implications? What has been the impact of COVID-19 for a developing country like Zimbabwe?
So the first impact has been on people's health and lives. We know that as we speak, in all over the world, we have had over 180 million cases of COVID-19 reported and over 4 million deaths. So the first impact of this condition has been on people's health and lives. In Africa, we know that we are almost having 100,000 lives lost due to COVID-19. And we see the same in Zimbabwe. Over 45,000 cases, close to 2,000 deaths. So that's really very, very big impact on individuals, on families, on communities, and on countries. So other than having an impact on people's lives and health, COVID-19 has had an impact on health systems. It has, stretched health systems really beyond not only in developing countries, but in other countries, as we saw. When the number of patients rises to a certain level, this really puts pressure on health systems. And when the health systems are pressurized, they cannot deliver other routine, regular health services. So again, it has indirect impact on the ability for people to access care, receive care, and have their health needs met. And as you have also rightly said, it puts a lot of pressure on economic performance. We have had to have lockdowns. This has had very adverse impact on the ability of the economy to run. It has had negative impact on schooling and education. Schools have had to close. Learners have had to stay away from school for prolonged periods of time. So COVID-19 has really had a very disruptive impact on virtually all facets of our lives.
Thank you. This year we saw several governments, including Zimbabwe, rolling out their vaccination programs. I just want to understand from where you stand as the WHO. We've heard and seen reports to the fact that the WHO also has its program that it plans to roll out these vaccines across the continent. I just want to understand, where are we right now as it stands?
Okay, thank you very much. So again, soon after this pandemic was started, based on the experience that we have had as the WHO with previous pandemics and large epidemics, including HIV, including bird flu, our experience has been that in the past, when new technologies, new vaccines, new drugs, new diagnostics become available, it takes a very long time for these new tools to reach the developing world. So based on that experience, the World Health Organization, Gavi, the Coalition of Epidemic Preparedness and Innovation, and UNICEF came together with the member states to form what is called COVAX. COVAX is a platform that aimed to promote the development of COVID-19 vaccines and ensure that once these vaccines became available, they could be equitably distributed to all countries, irrespective of the country's economic status. The aim was to prevent what had happened in the past, where it would take 10 years or so many years before new technologies and new vaccines and medications would become available to low-income countries. So this was the reason that this platform called COVAX was established. And the idea was that once the vaccines were made, manufacturers, the countries that where these manufacturing plants are, would collaborate under a global mechanism to make vaccines available. And then these vaccines would then be distributed by a transparent, participatory mechanism to all countries. So that was the idea, and it has worked to some extent. As we speak, the COVAX has supported the distribution of close to 100 million doses of COVID-19 across 134 countries across the world. So it has worked to that extent. However, we had hoped that by this time, a lot more vaccine would have been delivered through this program. The COVAX has had to face competition from countries buying directly from the manufacturers. A lot of, especially the richer countries, were able, because they have the financial capacity, to really buy large quantities of vaccine for their own domestic use. So again, COVAX benefited a lot from vaccine manufactured in India. India is one of the largest vaccine manufacturing countries in the world. So a lot of the initial doses that came into COVAX came from India, but unfortunately at some point, India also had a huge COVID-19 outbreak in their own country. And so they prioritized their vaccine production for their domestic use, which is what one, I mean, it's quite understandable. If you are producing vaccine and you need it most at home, you prioritize your own domestic needs before you can supply the international needs. So the number of doses that have come into COVAX up to now that have been distributed are less than what was anticipated at this time. However, the prospects are looking much more brighter as we get into the second half of 2021. A lot of the richer economies are increasingly donating some of the doses that they had procured for their own domestic use into COVAX, and this is also being now distributed to lower income countries.
Thank you. You spoke about equitable distribution, but if you notice, during the first 6 months of the year, the richer countries were quite reluctant in maybe donating some of these doses to the poorer countries. As WHO, did you try in any way to engage such countries so that maybe they can assist these developing countries? Because we realized that there was a lot of vaccine diplomacy at play. You see that for countries like Zimbabwe, for example, they were getting maybe vaccines from the eastern bloc of the world, that's Russia, China, and India.
Thank you very much. So the whole discussion about establishment of COVAX, the principles, how it would work, where the vaccines would come from, this was done in a very, very participatory way with all countries of the world, including the richer countries, the countries where vaccine manufacturing is taking place. So everybody was around the table, everybody participated in these conversations, and the principles of equitable distribution, ensuring that the people who were at highest risk received priority with the initial limited doses of vaccine. These were all discussed with everybody, and there was agreement. There was agreement across the table, but we know that in some of the richer countries, there was a lot of domestic demand that since they had put their own money, their taxpayers' money, to support the vaccine manufacturers to accelerate production, and they had actually invested billions of dollars, there was a lot of domestic pressure on some of the governments to attend to their domestic populations first. And so somehow and we ended up seeing some of the countries first focusing on their own populations, which was not in line with what had been agreed. WHO at the highest level kept engaging with all countries, reminding them about the equitable discussions and agreement about equitable distribution, and also emphasizing that, it was in everybody's interest that this outbreak is stopped as quickly as possible. We have seen that where the outbreak continues to rage uncontrollably, new variants are emerging. And these variants ultimately, again, go back to some of the countries where maybe vaccination had taken place. So a lot of advocacy, a lot of discussion, a lot of negotiation at the highest level has been going on over time. And we are happy that at least now we are seeing more and more of the rich countries donating doses to COVAX.
All right, thank you so much. Now let's move on to one of the most pertinent questions that people this part of the world often ask: how come Africa, or rather African countries, do not manufacture their own vaccine? We are told that Africa is one of the richest continents in the world in terms of resources and even manpower. But why is it we have to continue relying on these manufactured vaccines?
Thank you very much for that question. So the manufacture of vaccines is it's a very high technology, very delicate industry, which requires a lot of expertise. Indeed, several countries in Africa used to manufacture different types of vaccine, decades ago. But because of the level of expertise required, the level of specialization, this industry did not take root on a large scale in Africa. It requires a lot of investment, and it also requires a lot of, vaccine manufacturing is a business. You invest a lot of money in a very highly specialized field, and you aim to sell your product and recoup the investment that you made. So limited technical expertise in our part of the world, limited capital investment was another factor. And then places like India, which have a large population, a large market, invested a lot in the pharmaceutical industry, in vaccine manufacturing, in drug manufacturing. And because they were so competitive, they were able to grab a large share of the global market, including from Africa. We have in Africa tended to secure most of our vaccines from India, which is now the largest vaccine manufacturer in the world, but also from other parts of the world. So all those factors somehow put us at a kind of disadvantage. However, with the lessons that have been learned during this COVID-19 pandemic, our leaders, both as leaders of individual African countries, but also through the African Union platform, have recognized that it is much, much smarter for us, much more strategic for us as a continent to manufacture our own vaccines. And so there's a very systematic effort right now, together with the World Health Organization, to ensure capacity for local vaccine manufacturing is established in Africa. A few weeks ago, 2-3 weeks ago, the Director General of the World Health Organization and the President of the Republic of South Africa announced that a new plant to manufacture COVID-19 vaccines had been launched in South Africa. And we are aware that other countries in Africa, other sub-regions of Africa, are also at very advanced stages of establishing such capacity. So we are very hopeful that by early next year, the picture will be different, and we will have vaccine manufacturing plants at quite advanced stages in our region. Yes, this has been sparked off by COVID-19, but it is anticipated that these vaccine manufacturing plants will not only be limited to COVID-19 vaccines, but will also be capacitated to produce other vaccines that are required in the African region.
Right. Thank you. Zimbabwe is currently experiencing its third wave of infections. And when you try and maybe measure it against the first lockdown, you realize maybe Zimbabwe was in level 5. Right now, we're in level 4 in terms of the lockdown. I don't know, from where you stand, how prepared or how is Zimbabwe's current response to the pandemic as it stands right now? Given that maybe the previous lockdowns, that was level 5 was much more effective. Is level 4, what would be really ideal at such a juncture?
Thank you very much. So the aim of a lockdown is to allow the country to develop capacities to respond to the outbreak. We know that a lockdown has very, very negative impact on livelihoods, on capacity of families, individuals, communities to meet their other needs. So a lockdown is not, in itself, the full solution. The solution is for people to understand what they need to do to protect themselves against the infection and to implement those preventive measures. If we were all complying with the preventive measures that we all know so well, that we have been talking about, that the government has been talking about for since the beginning of this outbreak, we would not be in the situation which we are in. We should not move unless it's absolutely necessary. We should not gather in mass gatherings. We should avoid situations where we are in crowded areas. We should wear our masks if we have to go out into the community, if we have to leave our houses. If we are sick, we should separate ourselves from others. If we were all complying with these measures, we would not be seeing the cases going up the way they are right now. So the government has to balance between lockdown for public health measures, as well as to allow economic activity to continue such that people can, manage to look after themselves, look after their families, and earn a living. So that is the balance that one has to take into account. So we are hopeful. We are hopeful that the compliance, the rate of compliance with preventive measures can increase, because that will help the number of cases to come down.
But one of the questions that have been asked by people in Zimbabwe is, are breastfeeding women allowed to take the current vaccines that are being administered for COVID-19?
Thank you very much. So there are different ways in which vaccines are prepared, are made, and how they work. So all the COVID-19 vaccines that we have currently are made up of either killed virus that cannot replicate, or a portion of the virus that cannot replicate, it's not live. So because these viruses cannot replicate, they are all, the vaccines are made up of components that cannot reproduce themselves. They are all very safe for pregnant and breastfeeding mothers. So the answer is yes, breastfeeding mothers should get vaccinated. The vaccines prevent against especially severe illness and death. And breastfeeding mothers should take advantage of this and get that protection.
Thank you very much. Maybe in closing, is there maybe a final word that you want to say to Zimbabwe in light of the current pandemic?
Thank you very much. So my appeal to all of us, to everybody, the government can do its part in guiding us, in informing us about what we need to do in implementing restrictions, but ultimately the action that we take as individuals, as families, as communities, those actions are what will help to reduce transmission. So my appeal to everybody, let us do our best to prevent ourselves from getting infected. Let us comply with the preventive measures. Let's not get out of home unless we really have to get out of our homes. And if we do have to get out of our homes, let us use our masks. Let us avoid crowding. Let us avoid being in crowded spaces. Let us inform and advise all the people who listen to us, who we can inform and advise to do the right thing. If most of us do the right thing, the number of cases will go down, transmission will go down. Thank you.
Thank you very much. That was Dr. Alex Gasasira, who is the country, the World Health Organization country representative for Zimbabwe. Thank you very much, sir, for your time, and have a pleasant day.
Thank you very much for having me.